The publish or perish syndrome is prime importance. So, educationists are trying to publish their articles in referred or peer reviewed journals. It is essential that research should be conducted in an ethical way. First, some of these norms promote the aims of research, such as knowledge, truth, and avoidance of error. For example, prohibition against fabricating, falsifying, and misrepresenting research data promote the truth and avoid error. Second, since research often involves a great deal of cooperation and coordination among many different people in different disciplines and institutions, many of these ethical standards promote the values that are essential to collaborative work, such as trust, accountability, mutual respect, and fairness. For example, many ethical norms in research, such as guidelines for authorship, copyright, and patenting, policies, data sharing policies, and confidentiality rule in peer review are designed to protect intellectual property interest while encouraging collaboration. Most researchers want to receive credit for their contribution and do not want to have their ideas stolen or disclosed prematurely. Third, many of the ethical norms help to ensure that researchers can be held accountable to the public. Fourth, ethical norms in research also help to build public support for research. People more likely to fund research projects if they can trust the quality and integrity of research. The ethical issues in human subject research have received increasing attention over last 50 years. Research ethics involve the application of fundamental ethical principles to variety of topics involving scientific research. These include the design and implementation of research involving human experimentation, animal experimentation, various aspects of academic scandal, including scientific misconduct such as fraud, fabrication of data, and plagiarism, whistleblowing, regulation of research, etc. There are many ethical issues to be taken into the serious consideration for research. For example, sociologists need to be aware to have a responsibility to secure the actual interest of all those involved in the study. They should not misuse any information found. There should be a certain moral responsibility towards the participants. There is a duty to protect the right of people in the study as well as their privacy and sensitivity. Confidentiality to those involved in the observation must be carried out, keeping their anonymity and privacy secure. The primary concern of the investigator should be the safety of research participants. The scientific investigator must obtain informed consent from each research participant. This should be obtained in writing. The investigator must explain how to privacy and confidentiality concern will be approached. The investigator must consider how adverse event, if some emergency that affect human life, will be handled. In addition, before enrolling participants in an experimental trial, the investigator should be clear in his mind that if a new intervention is being tested against the currently acceptable treatment, the investigator should be genuinely uncertain which approach is superior. In other words, a true null hypothesis should be exist at the onset regarding the outcomes of the trial. The first ethical principle is autonomy, which refers to the obligation on the part of the investigator to respect each participant as a person capable of making an informed decision regarding participation in the research study. The second ethical principle is obligation on the part of the investigator to attempt to maximize benefit and the individual participant or society, while minimizing risk of harm to the individual. The honest and thorough risk benefit calculation must be performed. The third ethical principle invoked in research with human subject is justice, which means selecting sample with the help of external pressure. The principle of justice also require equality and distribution of benefits and burdens among the population groups likely to benefit from the research. The potential participant must be informed as fully possible of the nature and purpose of the research, the procedure to be used, the expected benefit to the participants or society, the potential of reasonably foreseeable risk, stress and discomfort and alternatives to participating in the research. The participant must understand what has been explained and must be given the opportunity to ask questions and have them answered by one of the investigators. The informed consent document must be written in easy language, avoiding any technical terminology. The participant consent to participate in the research must be voluntary, free of any compulsion or promises of benefits unlikely to result from participation. The participants must be competent to give consent. If the participant is not competent due to mental status, disease or emergency, a designated person may provide consent if it is in the participant's best interest to participate. The certain emergency cases, consent may be waived due to the lack of competent participant. As a general rule, deception is not acceptable when doing research with humans. Using deception nullify the integrity of the informed consent process and can be potentially harm your participants. Occasionally, exploring your areas of interest fully may require misleading your participation about the subject of your study. For example, if you want to learn about decision making practices of physicians without influencing their practice style, you may consider telling them you are studying communication behavior more broadly. Finally, many of norms of research promote a variety of other important moral and social values such as social responsibility, human rights, animal welfare, compliance with the law and health and safety. Ethical lapses in research can significantly harm to human and animal subject, student and the public. For example, a researcher who fabricates data in a clinical trial may harm or even kill patient, and a researcher who failed to abide by regulation and guidelines relating to radiation or biological safety may risk his health and safety or the health and safety of staff and students.